Hello and welcome. Today we're diving deep into a less commonly discussed, but potentially serious heart condition, chronic pericarditis. We'll explore what it is, what causes it, how it affects the body, and what can be done about it. So, let's get started. Chronic pericarditis isn't caused by a single, easily identifiable factor. Instead, it often arises as a complication of other conditions or events. One of the most frequent causes is prior acute pericarditis, where the initial inflammation doesn't fully resolve, leading to a persistent or recurrent problem. Infections, both viral and bacterial, can also trigger chronic pericarditis. Autoimmune diseases like lupus and rheumatoid arthritis are known contributors, as the body's immune system mistakenly attacks the pericardium. Less frequently, it can be caused by tuberculosis, cancer, kidney failure, or even chest trauma or surgery. Sometimes, despite thorough investigation, the underlying cause remains unknown, which is termed idiopathic chronic pericarditis. To understand chronic pericarditis, we need to talk about the pericardium. This is a sac-like structure surrounding the heart, composed of two layers with a small amount of fluid in between. In chronic pericarditis, this pericardium becomes thickened, scarred, and sometimes even calcified. This thickening restricts the heart's ability to expand and contract normally. The thickened pericardium can lead to constrictive pericarditis, where the heart is literally squeezed, preventing it from filling properly with blood. This results in reduced cardiac output, meaning the heart can't pump enough blood to meet the body's needs. This can lead to fluid buildup in the body and other significant complications. Chronic pericarditis is relatively uncommon compared to other heart conditions. Accurate epidemiological data is challenging to obtain because many cases are either mild or go undiagnosed. The prevalence is higher in regions where tuberculosis is endemic, as TB is a known risk factor. Certain populations, like individuals with autoimmune diseases or kidney failure, also have a higher risk of developing chronic pericarditis. While it can affect individuals of any age, it's more frequently diagnosed in adults. The symptoms of chronic pericarditis can be subtle and develop gradually over time. The most common symptom is shortness of breath, particularly during exertion. Fatigue is another frequent complaint, as the heart struggles to pump sufficient blood. Patients may also experience swelling in the legs, ankles, and abdomen due to fluid retention. Chest pain is possible, but it's typically less severe and constant than the sharp, stabbing pain associated with acute pericarditis. Some individuals may also have abdominal discomfort and a persistent cough. It's important to note that symptoms can vary significantly depending on the severity of the condition and the presence of complications like constrictive pericarditis. Diagnosing chronic pericarditis requires a combination of medical history, physical examination, and diagnostic tests. A doctor will listen to the heart for abnormal sounds, such as a pericardial knock, which is a high-pitched sound caused by the thickened pericardium. An electrocardiogram, or ECG, can reveal abnormalities in the heart's electrical activity. A chest X-ray may show an enlarged heart or calcium deposits in the pericardium. An echocardiogram, which uses ultrasound to create images of the heart, is crucial for visualizing the thickened pericardium and assessing the heart's function. More advanced imaging techniques, such as cardiac CT scans and MRIs, provide detailed views of the pericardium and can help differentiate chronic pericarditis from other heart conditions. In some cases, a cardiac catheterization may be performed to measure pressures within the heart chambers. While there aren't distinct types of chronic pericarditis in the same way as some other heart conditions, it's important to distinguish between effusive, constrictive pericarditis and pure constrictive pericarditis. Effusive, constrictive pericarditis refers to cases where there is both fluid accumulation within the pericardial space and constriction of the heart. In these cases, simply draining the fluid may not resolve the constriction, because the thickened pericardium is still restricting the heart. Pure constrictive pericarditis is characterized by the thickened, rigid pericardium without significant fluid accumulation. The treatment of chronic pericarditis focuses on managing symptoms, addressing the underlying cause if identified, and relieving the constriction on the heart. Medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and corticosteroids, may be used to reduce inflammation. Diuretics can help to remove excess fluid from the body. If the underlying cause is an infection, appropriate antibiotics or antifungal medications will be prescribed. In severe cases of constrictive pericarditis, a surgical procedure called a pericardiectomy may be necessary. This involves removing the thickened pericardium to allow the heart to function normally. The timing and suitability of surgery depend on the severity of the condition and the patient's overall health. Lifestyle modifications, such as a low-sodium diet and regular exercise as tolerated, can also help to manage symptoms. Preventing chronic pericarditis primarily involves promptly treating acute pericarditis and managing underlying conditions that can contribute to its development. Following medical advice for infections, autoimmune diseases, and kidney failure is crucial. Avoiding excessive alcohol consumption and maintaining a healthy lifestyle can also help reduce the risk. The prognosis for chronic pericarditis varies depending on the severity of the condition, the underlying cause, and the effectiveness of treatment. In mild cases, symptoms can be managed with medications and lifestyle changes. However, severe cases of constrictive pericarditis can lead to significant heart failure and require surgical intervention. Pericardiectomy is generally effective in relieving the constriction, but it carries risks, as with any surgery. Recent research is focusing on developing less invasive techniques for pericardial stripping, as well as identifying biomarkers that can help predict the development of chronic pericarditis after an acute episode. Further studies are also exploring the role of genetics in predisposing individuals to chronic pericardial disease.